Really welcome to Social Work Week and welcome to Making the Invisible Visible, improving the approach of equality and diversity in safeguarding reviews. Really looking forward to this session, and it's a jam-packed session. I really hope you enjoy it. Just got a few housekeeping slides to go through. First of which is our legal disclaimer. So any views, information or opinion expressed by third parties during Social Work Week are the speaker's own and do not necessarily reflect the views of Social Work England. Social Work England accepts no liability for the content of third party or sector-led sessions held during Social Work Week. And our privacy notice: your privacy is important to us. By providing personal information such as your name and email, you agree to us contacting you for the purposes of event management and evaluation. Your personal information will be used solely for the purpose it is collected, and personal data will be retained for up to 3 years in accordance with our data retention schedule.
Thanks, Vicky. So I'm Adi Cooper. I'm a member of the Social Work England board. I'm a social worker and I'm here to chair the session. I'm really pleased to see you all here this morning for Social Work Week. I'm also really looking forward to hearing today's presentation because I am a Safeguarding Adult Review author. I chair 2 Safeguarding Adult boards, and as a person who works for an organisation called Partners in Care and Health, I've commissioned national analysis of safeguarding adult reviews, and which have shown, and the second one's due to be published, show a real lack of I suppose a lack of attention to the areas that I hope we'll cover this morning, and I'm really hopeful that the recommendations coming out of this morning's session will help all of us who are in this field. Vicky, somebody's saying in the chat they can't hear me, so hopefully you'll be able to sort that out, colleagues. I'm going to pass over to Vijay and Kanchan to introduce themselves, and I'm really looking forward to hearing what you've got to say to us. Thank you.
Good morning, colleagues. I'm Vijay Patel. I'm Head of Safeguarding at Sky, Social Care Institute for Excellence. I'm a social worker, and prior to this, I've also worked with safeguarding boards, adults and children. And certainly our reflections today are sort of based on our learning from what we'll be doing there. Kanchan.
Thanks, Vijay. My name's Kanchan Jadeja. I'm also a social worker working with Spiritus, which is my company, on improvement work, reviews, and reviewer for the National Panel for Children Safeguarding.
So we just put up a glossary here because I'm conscious some people will be familiar with the language we're going to be using, some people won't. So if we may use shorthand for brevity, and these slides will be available later for you. So we'll talk about LSCPs, Safeguarding Children's Boards, Safeguarding Children's Boards Partnerships. We'll talk about SABs, Local Safeguarding Adults Board, SARS, which is the adult reviews, CSPRs, which is the children's reviews, DHRs, domestic homicide in terms of domestic abuse, and the acronyms for government departments and the national panel. Next slide, please. So we've called this Making the Invisible, and if you can click again, visible. And it's very much because of our experience around when it comes to all sorts of issues around diversity, be it sexuality, be it faith, be it ethnicity. It's always been quite a challenging area for boards and reviewers. So we wanted to share some of our learning around what we think, why that happens, and what we can do to try and improve that. Next slide. And also, it's for us important to recognise 2 people. Some of you will be familiar with Fran Pearson, who sadly died last year. She was a board chair and a reviewer, and was very passionate and sort of very much was key in trying to raise these issues in the stuff she undertook. And fewer people were familiar with Marcia Spencer, who was a Black issues consultant back in the 90s, who sadly died 10 years ago, but one of the biggest advocates around Black children in care, and again, very much thinking about that issues of intersectionality, identity. And I think we're very much working from their legacy, the stuff they developed, the stuff they pushed. So, and again, it's really important that we recognise those supporters, those people who've championed these issues over a long period of time. And they were very much committed to making these issues visible. Next slide.
When we were thinking about doing this session, we thought that as good social workers, we start with ourselves. And we wondered whether people on this call might want to just reflect for a moment what it feels like to be invisible. Think of a moment recently or in the past when you were not heard, not seen, and felt invisible. So we'll take a moment. And really what we wanted to do was to check in with people in terms of yourselves and ourselves, what it feels like, what kind of emotions does that evoke? Anger, frustration, and layered in safeguarding with the other emotions that are there. You can see that it's so important for all of us involved in carrying out reviews that we make the invisible visible. Next slide, please.
And again, that bit about visibility, I was training a group of staff who work with people with visual impairment yesterday, and I was terrible because they were really good at feeding back to me about what I needed to do to change my staff to make sure for those who had a visual impairment, I was able to deliver content in a way that was appropriate to them. So again, there's something about learning for all of us, and it's an ongoing process. For those not familiar with safeguarding reviews, they're both required on statute. For adults, it's care act guidance in terms of when an adult has died or experienced serious harm or abuse. And for children, again, similar to when there's been serious abuse or neglect, or they've died or been seriously harmed. So that's criteria. The key thing is, again, for both, we aim to have them completed within 6 months of starting, and we're going to come back to that timescale later on. So we're basically, this is based on what is required in terms of law and statute. Next slide.
Yeah, so in terms of a lot of social work processes, we know that there is a lot of bureaucracy involved. In some cases, that's our accountability, and that's right. So we wanted to reflect back in terms of the boards and the processes that happen, what makes a child or an adult review invisible. And in some ways, the reviews reflect what happens in practice. So you've got board processes, we've got information, and we've got availability of evidence, which I think is one of the key areas that when we're looking at carrying out reviews, where is the evidence? And often that is what is invisible. And so how can we make that visible within those processes? And we will review that and discuss that in this talk. Thank you. Next slide, please.
But why the focus on equity and diversity? The first bullet point is about an adult review, which when it first came in, all the information said he was a South Asian man. It was fortunate that my administrator then had met the person in the previous job and said, he's not South Asian, he's Somalian. But it was significant that nobody had spotted that, or nobody actually asked him, and just taken it from previous records. And Michael Preston-Shute would also point out another SAR last week to me around homelessness, where a person was identified as Greek Cypriot. Actually, he was Roma Cypriot, which had really big key differences, but that wasn't picked up. So again, if we're getting the information wrong from the start, we're already going down the wrong track. And that's not just about ethnicity. It may be about the type of disability. Is it identified? Is it recorded? Are we actually asking questions around sexuality in an appropriate manner? The second one was a young baby who sadly died. And again, in that case, that was really heart-wrenching for me because I knew about that community. And what really struck me was that there was no questions being asked, and there was no recording which said, how do we make sense of what happened to this mother and baby in the context of their community and the fact that they were really, I suppose, pushed out of the community and kept in isolation, and so really vulnerable by being young and having a baby, but also being ostracized from their community.
Yeah, so another review is one where, and it's published, so I can mention it's the Usman review that we are going to refer to in this talk, where a young South Asian man took his own life, a child, and through trying to understand, and it was a difficult process, we found two sisters for whom the whole journey had been without support from services, and as adults, they became very, very vulnerable. And so when we're looking at mapping that, we could see that the invisibility of their experience within the services and the way the services are structured is what is important in reflecting in a review, so that we can learn from that and improve services for the ones that are coming down the line. Another review where we use the word invisible child in many cases in that review is the Al-Sami review, again published so people can refer to it. And clearly there were gaps. There was a child, and we know that this is not just in terms of EDI, that there are invisible children out there within all families. And I think that what we're saying here is that this is layered with inequality, and that we therefore have to work that much harder. I think it is true to say that, and be more determined to understand their experiences in making those visible. Next slide, please.
Yeah, professional experiences focus on invisibility, and I just want to pick up on the issue of neurodivergence that somebody made in the chat, because again, we talk about neurodivergence, but actually, are we very good at understanding what that means? How do we enable people? How do we involve them? So again, we'll come back to that later. But again, that bit about invisibility is when I talk about Child L, who was a young South Asian girl who sadly did commit suicide. When you looked at the records, we didn't know who she was. We couldn't talk about her, what her likes were, what her dislikes were. And even more so, what was the motivation? Because there was nothing there in the record. And although we'd explicitly asked for that, nothing came through. And Kanchan mentioned family husband. And again, what was really frightening there was the lack of connectivity in terms of the information. There was information about the young man, but these two young women who'd also had a number of troubled incidents, they'd never been connected up. Nobody said, okay, we focused on this person. We don't focus on them in the context of their family and their community. So as a result, they were invisible. They were involved with police, they were involved with health, in mental health, but really, there was nothing there. So it's only when you had the serious case review, we found, hang on, there's lots of stuff happening here. And again, similarly with Sammy.
Absolutely. As I've said before, that this is a child who was invisible. They talked about him as being happy, and when we spoke to Mum, and it's in the review, she said he's the one who's trying to make everyone happy. And within the context of that family, and there were cultural issues, that pulling all that together in the review. So what happens is that if the work isn't carried out within practice, it is incumbent on the reviewers and the review to pull that together. And I think that's what we attempted to do there. And this is really a call out for us all to do that every time we are carrying out reviews. Recently, there's another review where a transgender issue was highlighted at the point of the review when services didn't actually realise. So I think that whilst we're looking at some of these reviews, the same applies for other areas of equality, diversity and inclusion. These are examples that we're aware of. Thank you. And next slide.
And many of you in the audience will be aware of others, which will be very similar in terms of that. And again, that's our professional experience in terms of the reviews we've been involved in together and separately. But again, the research evidence also points to that. Again, the last analysis from Michael Prestonship in 2020 flagged that in terms of mention was that of race, ethnicity and culture was largely absent. And I know he's going to be saying the same thing in a forthcoming one that's due out shortly. And Marion Brandon in the last analysis of CS case reviews again made a point that there was little about the implications of the data-laid lives and experiences of the children. They're not explored or spelled out. And if we don't have that, then how do we understand, how do you start to analyse what the lived experience was, what was needed in order to make a difference and have an impact? And again, those issues cross over for all those issues around gender, age, disability. Next slide. So, well, Kanchan and I, and again, this is not new. A lot of this will be new to, will be obvious to a lot of people, but we start off with actually, why do people become invisible before they even come to the review process? The first bit is about accurate recording. Are people comfortable asking about ethnicity, about faith, about disability, both diagnosed and undiagnosed, etc. So actually, how comfortable are we about talking about it? And I want to put just a mention of the work that Adi and Anusra have done at LG on PCH around discriminatory harm and discriminatory abuse. They've got a toolkit out, which is a very helpful starting point. So if you're not familiar with it, you can Google it on LGA, discriminatory abuse toolkit. There's some good information there. It's a bit about not recording it, but then also not understanding or being able to know how to assess it as part of practice. What does faith mean for a Somalian child who's second generation? Or issues like that, actually, how do you start to put it on the lens and think about its implications for that child or for that adult in the context of their family, their loved ones, their community? There's a lack of analysis, but then again, that isn't there in the records. And also people are quite often, we know this, because practice tells us, people are really not confident about exploring those issues. How do I start to have this conversation about sexuality or about neurodivergence or about age for this person in their context? And actually, a social work, for those of us as social workers, actually for those of us health visitors, nurses, it should be part and parcel of being person-centered. What is important for you? What matters to you? What are your wishes and feelings? Standard questions, and I think there's something about what causes people to be disabled in asking those questions. The other bit, which is harder, and this is where I think, you know, some of the bits about skill is the intersectionality, understanding not just the experience of faith, but alongside gender, alongside community. So if I think about the baby, it was understanding that for a South Asian woman, how does she perceive herself in the context of a community which had a very strong set of values, which was what she was struggling and pushing against. How do you start to analyze that? How do you start to think, what does good support look like for her? And what does good support look like for her trying to parent a young child? So there's the lack of analysis. But to do that, we need to have conversations with the person, with their family, with community. And again, when we've done that, and we'll talk about that a bit later, we get a much more richer experience of what happened for this person and an understanding of that. And again, when I talked to Michael Preston-Shoot last week, he made a really helpful point. As a star reviewer, he's got a habit of going out to the place the person frequented and just having a bit of experience of what might it be like, just seeing it visually, physically, and giving you a different insight into what was happening for that person. Kanchan, next slide.
Yeah, thank you, Vijay. So in terms of boards and partnerships, this is the area where I think we can make change, and those on this call are part of those processes. It's just an opportunity to pause, to think about how the processes work. We know that there are always timescales, and there is information that and I think going back to Fran Pearson, she was really good at pausing. She would stop the process and say, as chair, let's just think about this. What's really going on here? And if it's not recorded, does somebody know? Can we talk to somebody, etc.? So really, it's not the process of reviews to be part of practice, but sometimes we have to go into practice in order to provide a review that reflects what happened or didn't happen in that case, and what's relevant information and what isn't relevant, and processing information, the way records are looked at, etc. I know that independent management reviews are not fashionable now, but agency reports or whatever it is, the review is only as good as that, and then those reports are only as good as the practice on the ground. But actually, if each part of the system carries out that role, then I think that reviews will really help us to learn and to move on. And that sometimes means that timescales may be pushed back. And in many of the reviews that we've included in this talk, that's what's happened, because the chair has paused the process to understand. There's been other processes that we will come back to in the course of this discussion. And in terms of equality, diversity, inclusion, intersectionality, cultures are dynamic. We know that, you know, second, third generation will have different, particularly who have come into this country, will have a different culture, different values, a different set of issues. And on that, we have to remember that we're talking about safeguarding. So these are families that are troubled. And when it comes to review, we know that that's the top of that pyramid. So very important that partnerships are courageous, board members, particularly the chairs, are courageous, and that we really look at what went on and why are these families or children, adults, invisible. Thank you. Next.
Sorry, if you pick 2 points there. If you can go back a minute, sorry. The bit about timescales, I think there's a challenge, especially for the national panel when it comes to children, in terms of 2-week rapid reviews, because in some cases that disables that access to information, that bring together information in order to understand actually, is discrimination an issue here? Is sexuality an issue? Because I think that 2-week timescale is challenging from that perspective. And also this bit about the 6 months, because actually we should be timely, absolutely. But in our experience, what we found is we need to take a bit more time in order to get some of the evidence to probe with practitioners what's happening and to get the perspectives. But that, I think, in some cases, it's the timescale that's challenging. The other issue I'd flag up around is about system. We talk a lot about systems learning, and we talk about hindsight bias. But I think there's a challenge because when we talk about systems learning, it focuses on workforce. It focuses on processes. It doesn't necessarily allow you to bring out issues around discrimination on whatever issue, on whatever element of age, disability, etc. So I think there's for me, a challenge to board chair to think, when you talk about systems learning, how are you bringing out issues around institutionalized discrimination? How are you bringing issues out around poverty and other bits, which all impinge and may be really important? And I know Michael, again, in the latest analysis, will flag up this bit about national learning. It's not just about local. And I think my criticism quite often is that we focus on local, but in doing that, we miss out that bigger picture around discrimination and the pressures around that. So I just wanted to flag that bit up there. So next slide.
Yeah, so we wanted to go back to this issue about the way in which the processes, structures and commissioning happens. And really, again, it's a plea to reflect, to look at how these processes work and perhaps how they could be changed, tweaked to ensure that equality, diversity and inclusion is at core, particularly for those reviews where we know that practice may not have reflected that. So information is key. We talked earlier about having reports and information from practitioners. What I find really positive, if such a thing is possible in this review work, is when practitioners talk about people they've worked with or children or adults, and you can get a rich sense of who those people are if that practitioner has a good relationship with the family. The terms of reference need to include equality, diversity, inclusion, and what we don't know, what is invisible, championing subgroups and pursue a question. Again, the good board managers and board chairs are the ones that are very curious and keep being curious until we get to the end of a review. The methodology is very systematic, and you know, Sky is one of the ones that many boards use, and there are other methodologies, but it's important that that is shaped to include EDI, and that it's not linear, that it's creative, it's inclusive. And for panel members also to ask the questions and to think about methodology, to explore and allow that space for looking at EDI and discrimination. We talked about evidence and timescales, and I don't know, and perhaps you know we can look at this when we have a discussion, is that sometimes you get, and this is a brilliant social work skill, I know we hardly ever mention intuition, but a sense in the gut where a social worker's just come out of a home or a panel, or when we're looking at reviews processes and thinking, do you know what, we need to look at this again. And I would say, and I'm sure Vijay and I both agree on this because we've had many conversations about this, is to pursue that. And there's a review recently of an adult where a major part of that person's sexuality was not known, and just kind of pursuing that has led us somewhere completely different. So I think we would urge that the evidence and timescales, and yes, again, the timescales are important, but there may be occasions when if we really want to get to the learning, we will need to pause and reflect.
And just around the evidence, it's a bit about recognising it's not just what's written in the case records, but it's also, is there other data available locally? You know, are you talking to community groups? But that is evidence, that's valid evidence about lived experience, where if you can't capture elsewhere. Health Watch in most places are really, really good at capturing a lot of helpful information. But also that bit about those special interest groups depending on those issues. Those are all valuable sources of rich intelligence that can help inform your thinking and understanding of that lived experience, if that's lacking. But we need to be more creative then, and moving away from actually what's written to understanding what else is out there. And again, from ethnicity perspective, the race observatory have been really, really good at pulling together a whole lot of data, which is really, really helpful and can give you a bit more where in terms of and taking things forward.
I think just before we move on from this evidence gathering and creative ways of doing that, we also need to be very mindful that there are some community groups and organisations that the people we are supporting as social workers may not want anything to do with. So it's a very carefully treaded path in order to gather that information, and we need to be careful. So we're not saying go to the local temple, mosque, or a synagogue, gurdwaras, places, the church, because that may not be the place to get that information that we want. Be really curious and mindful about that. So just to share that.
Next slide, please. So again, there's some strengths around independent reviewers and some challenges for reviewers. And for those who aren't familiar, in most cases for safeguarding review, somebody independent would be normally appointed to take on that role and to draw the information together. Now, we recognise they face many challenges when they're trying to draw these issues around equity, etc. in. And I can think of several cases where we put in terms of reference, they've tried their hardest, and they come back saying there's nothing there. Okay, and actually, so how do you write about something if you've got no evidence? So that's one of the things we'll talk about shortly. And so we know a lot are doing their best in really difficult circumstances, but we think there's other gaps in terms of how do our pool of reviewers for adults and children reflect our communities? And there is a need to broaden that pool to make sure that actually, as we said, that in some cases it's that nuanced understanding around Cypriot Roma communities, which I would know nothing about, but again, understanding that will give you a different nuance to what life was like for that person in that context. So the bit about reflecting our communities and those different issues. And also the other bit, how do boards become proactive in terms of supporting the reviewer? This is not the reviewer's job. It's one person in this jigsaw. But quite often we leave it to the reviewer to say, okay, go find out and go tell us what to do. This is a board responsibility, it's a partnership responsibility to make these issues of visibility visible, but quite often we focus on the independent viewer, and I think that's not fair on them. Next slide.
So in terms of potential solutions, I think we've referred to some of them as we've gone through this talk, is to focus on seeking the family and relatives' views, again with the being mindful that it needs to be appropriate and it needs to be relevant to the issues for that person. So, for example, in one of the reviews, it wasn't appropriate for us to go back and speak to the family, and that's fine. But to find creative ways, as we've said, to get that information. But to have family, if it's appropriate, involved at the beginning is an absolute solution to understand what's going on. And using particularly for those on the call, social workers, and we're on Social Work England time here. So absolutely those skills of assessment, review, looking at risk, all of that in involving families and relatives' views. Ensure acceptance of wider community and research. For example, in one of the reviews that we've referred to here, we've been to the school, and although we didn't say anything about anything, we just met with the peers of this young person. And that gives you a sense of what the school's like, what it feels like to be a child in that school. Another review to Health Watch, as Vijay has said, to look at, because Health Watch will have hopefully some information about that particular issue. And this is very important around disability, around some of the neuro divergent type issues. So those kind of conversations with other professionals are important. Schools are really good for particularly children. And one of the reviews we referred to here, Al-Sami, I mean, that's why we called the review Al-Sami, because at his primary school, he was a delight, and the teachers really, their faces lit up when they spoke about him. And that gives you a sense of that child. So really important to bring the human part of the child or the adult that we're reviewing. And to develop, as Vijay has said, a wider pool of reviewers, where that can be reflected in the board, certainly in the board structures as well. And the safeguarding structures, the safeguarding adult board and safeguarding children board, that diversity isn't about the community representative, but more wider within the structures of the board. And board champions, there are people, and those of us who work with panels and boards, we know there are champions, you know, that person who will be courageous, who will challenge, who will say that, but it would be really important for everybody to own that. Otherwise, that person becomes exhausted, and or it's passed on to the reviewer, who then is grappling with some issues without necessarily having the authority or the response to be able to gather that information.
Just one point I was going to make about, what was it? I've forgotten. I'll come back to it later.
Okay. And I guess, you know, Sky, important in this, Vijay, isn't it? How quality markers enable this rather than not enable them. And again, this comes back to the terms of reference, using this slide to look at the terms of reference at the start of the process. Is an important part of this process, I think.
Yeah.
Next slide, please.
Okay, and again, when we're doing research, I'd forgotten about this, but the expectation about involving the peer person is very clear in both adult SARS, safeguarding adult reviews, and in children's. So the top one just recognises, you know, is in the Care Act guidance. Early discussions need to take place with the adult, family and friends. So it's there, it's expected. And I'm very conscious from a conversation a few weeks ago with independent reviewers that it's a big frustration for reviewers in terms of trying to manage that. So again, there's something for a challenge for boards and partnerships. Say, do we really mean this? How are we going to enable this? How do we support that reviewer? Do we use GPs? Do we use schools, other links, etc., to be able to get that inroad into that early engagement with the family, relatives, etc. And again, similarly in working together for children, it's set out that families, you know, that the safeguarding partners should ensure that families are invited to contribute, and families understand how they're going to be involved. So it's already set out that we should be doing this. But again, it's interesting, and maybe I don't know if it's a disabling thing around diversity that prevents that, or is it about timescale? It may be a mixture, but I'm putting that challenge back out, saying the guidance is very clear about that involvement of families. And again, that's how we make these things visible. And I think Kanchan sort of told me a few weeks ago about another start she's involved in, where going to see the family changed the whole concept or scope of how their family was perceived and how the male was perceived, by having gone out and seen them and just seeing how close they lived, which gave a different view to what was being shared by those professionals. And remember, we need to just balance that picture of what the professional's experience of work is, as opposed to that individual and that family's experiences.
Yeah, and just on that, I think going back to the point you were making, Vijay, about the area, even if you just kind of drive around or walk around in those areas, it's where that person lived. I think it gives a real sense to the reviewer of what life may look like for that child or adult. So it is about being creative and really looking at what is it that we're trying to understand here about what happened, so that there can be learning for future. That's what reviews are about. And the more thorough that process is, the more likely we're to extrapolate that learning.
Next slide, please. Okay, and so again, for boards and for reviewers and for families, what's the purpose of a review? Who is it for? And there is that tension that both the board and reviewers need to manage and think. And from the board's perspective, it's about understanding, drawing out learning. What could be changed? What could be improved to prevent and avoid in the future? But from families or relative experience, or the person themselves saying, well, in some cases, there will be something, I need somebody to blame. This should never have happened. That needs to be managed. And again, at this level, lots of people, I'd expect board chairs, etc., to be skilled to manage those conversations and to work with families, and for senior partners within the board to have those conversations, to accept those issues and that confrontation, but also then to work with families to say, okay, what is it you want? How to, in my experience, when I've talked to families, they've been very keen to share learning because they don't want anybody else to go through it.
Yeah, I just wanted to come in there in terms of some of the panels. I think there may be a need for training, because I think people are actually afraid even when families have agreed to meet with panel members, people will say that they either don't want to meet or don't meet. And that kind of needs to be managed by the chair to draw out the reasons why people feel like that. And actually, when people do meet with families, they realise that, yes, there may be anger, hurt, pain, they've lost a loved one, and things that have happened that have highlighted the issues that have come to this level of reviews. However, it makes the reviews stronger. And I think it comes back to that issue around humanising people. You know, we can go through the whole process very often without speaking to anybody and look at processes. And the other issue around families is that it's processes versus people in some ways. And we have to have those conversations openly and not often leave that to the reviewer to grapple with. But in a panel, you know, why is it that you don't want to meet this? You know, what is it that we're concerned about? And then to provide the support to do that. And I think once people get into that, they will find a better process for them and the review.
Thank you. Next slide. Nearly there, folks. You'll be glad to know. So again, a bit about, we talked about champions, and we need within board structures, within panels, we need multiple people to be a voice, to challenge, to ask a question about disability, about sexuality, whatever. But it quite often it boils down to one person. It may be a very good chair, it may be a good business manager, but actually we need multiple people to do that. But and we also need to be open to listening to them and asking, thinking, why are they asking this question? They're not being difficult? But we do get into tunnel visions, and it's not, I understand why it happens, but we have to allow ourselves to open ourselves up to hear that challenge and to ask ourselves, well, is that a possibility? Might that have happened? How do I deal with that? So again, there's a bit about how do boards create that culture around curiosity and positive challenge. Okay, and again, that's where some of these things about working with, you know, sort of doing work with Health Watch and others can help you draw that information out to sort of then make it a bit more open. The other bit is what I was going to say was, again, social workers and others, we can, and especially in board, we can become tunnel vision. So we do need other people. And the point I was going to make earlier was we used to have lay members on safeguarding boards. We seem to have moved away from that. And I think that's a real pity, because again, sometimes good lay members can just bring people back to, this is what life is like in this community, in this area. Because most of us don't work in the areas where we don't live in the areas where we work. So we don't necessarily have that lived experience. So that bit about lay members I think is quite helpful. If we can move on to the next slide.
Yeah, so in terms of becoming invisible, we talked about the role of the community, which is an untapped source, with that proviso of being careful that we speak with, that we, you know, don't go to the community leaders, but those people within the community. When we have carried out that type of piece of work, it's been really positive, and actually it's brought in the multi-agency partners to look at their practice and to look at how that can be changed. So really important to do that.
Next slide. And again, in terms of what we're doing, so I'll talk on behalf of Sky. We're currently developing a proposal around accrediting safeguarding reviewers, and we're talking to Department of Health about that. So we're going to be doing some work there over the next week. I'll see if we can progress this bit about widening that pool, and also making sure we get consistency and very much bring these issues into the fore around the next generation of safeguarding reviewers. And there's other things that you may think of. So if you've got ideas of what else could be done, we'd welcome them. You put them in the chat or pose a question to us. If we can go on to the final slide. Sorry, also not final slide, next one. The other bit is thinking about quality markers, which I know some people use, some people don't. But in my experience, I think the bit is their process, and we need to probably revisit them to make sure they do actually draw out those issues and explicitly ask those questions around equity, diversity, etc. So that may be something I'll pick up as part of my role, but I'm also welcome to hear from other people on that. And hopefully this is the last slide, I think. Next one, please. Yeah.
Yeah. So we wanted to kind of end with a quote, which I think is probably a creative way of that we've talked about in this talk, is one from Sufis in 1292, a long time ago, that deep in the sea are riches beyond compare. But if you seek safety, it's on the shore. So if we want good reviews and we want to make the invisible visible, we do have to dig a bit deeper. Thank you.
Thank you.
Just going to thank you, and I think AD, I'm just going to pass over to AD to give our thanks to the presenters before we move to Q&A.
So thank you both. They're really, really useful and challenging, I think, as well, presentation, and lots of comments in the chat and some really good questions, hopefully, Victoria, that you'll be able to bring up. But thank you so much for that. Some real making visible invisible prompts in terms of what people need to think about in whatever roles they have. I always argue that safeguarding is a very long learning curve, and we're somewhere fairly, in adults work especially, very much on the beginnings of it. Adult safeguarding was only made statutory in the Care Act in 2014, so we're still learning. I won't comment on the children's side because that's not my knowledge base, but we've got a lot to learn, and I think your contribution this morning has been really helpful in that process. So back to you, Vicky, in terms of the specific questions that have been asked.
Yeah, thank you so much. And I've got a few questions. I don't think we'll have time for all the questions. We'll see how we get on. So one of the questions coming in, reflecting on my lack of exploring identifying characteristics of those I work with, any advice on the best ways to approach this, how to bring the subject up and open up discussions?
My simple thing, I used to work in Dundee as the only non-white social worker for, I don't know how, for quite a few years, back in the 90s. So I would go and say, I don't live here. Tell me what's life, what's important to you? What's life like here?
Absolutely. And I think that one thing is that I guess is another issue is to not go away from here and think you don't know anything. You know, people will be qualified, they will know their social work, and to apply those skills to this issue and not be afraid to have the conversation. You know, that's what I would say. And do your research about in terms of the research in terms of written research, but also the family and the community, as we've discussed here.
And just one thing I want to add there, because one thing there, because it's quite often we tend to assume that communities and cultures are static. They're not. You know, if you're a Somalian Muslim compared to an Egyptian Muslim, it's different. I'm not going to know that. So that's why I need to ask the question, tell me what matters to you. If you have a faith or none, what do you do? Because it's going to be different. My household is going, in terms of Hindu, and very different to Kanchan's, which is fine. So I'm not going to assume. Culture is always dynamic. So we shouldn't focus on static tropes and stereotypes. But that's why we need to ask the question. Yeah, what matters to you? What do you do? It's open questions. There,
because I think that fundamental question, sort of tell me about yourself, your experience, is really good, and the nuance, because we also need to be very mindful of stereotyping when we're looking at issues around identity. And for me, it's back to what Kanchan's saying about social work skills, about not just listening to what people are saying, but what they're not saying, especially when there are issues, say, for example, around sexual identity, or even some issues around neurodiversity or areas of disability, where there may be, because of the way society perceives those identities, shame and exclusion, multiple added layers of exclusion. So I would say it's the active listening social work skills around listening to what's being said, but also what's not being said, that really helpful in trying to understand how somebody is situated within their multiple identities. We all have multiple identities.
Absolutely.
Thanks so much. Another question. Enabling practitioners to inform accurate decision making on invisibility is key. What do you suggest when resistance from some service areas, this is in terms of working situation, including managers in leadership, is the key to, in my view? Are there gaps in training and or curiosity?
All of that, I think.
For me, the other bit is actually evidence. So I'm always very hot on reading evidence, national or local. because then there's a logical argument. Okay, you're saying, and I remember a conversation with the DCS, your own name, about saying, oh, well, it's not on my priorities. Well, it may not be on your priorities, but if you look at the data that we're showing locally around these issues, maybe it should be. So for me, actually, I use a very logical, rational argument. Here's what the data tells you all. We don't have that data, but given our community, given our demographics, you know, in terms of disability, etc., this is why we need to ask a question. And somebody asked it a point raised about leader, and again, I picked the same thing up. Actually, we see over-representation in leader reviews around ethnicity. So again, that needs to be fed back in. What is that about? What is happening locally to shape the different service offer to prevent that?
And I know this might be a bit of a basic question, but could you just explain what leader is? Because people might not all know within the chat.
I always forget what the acronym is, but it's basically a review of a death of a person with learning disabilities, in short.
Thanks.
And they're required by NHS England, so every locality has them. They have a panel and an independent person going to look at what's happened in terms of that the health and other bits for that person.
Thanks so much for that.
Can I add something about tactics and strategy if people are experiencing challenges within their organisations at the level at which they are? That leadership works on all levels, and I think as social workers we are encouraged to be courageous and brave. I think Kanchan talked about that at the end. So in my long years of experience of working at lots of different levels within particularly statutory social services, I would really argue around alliance building and tactics. So if you're struggling with particular people higher up the hierarchy, is to find the ways in which you can build alliances with other people, and particularly around these issues, because to be fair, a lot of people are ignorant around a lot of stuff. I mean, you talked, Vijay, about the Roma Cypriot person that Michael Pessenchuk came across in a homelessness review in Haringey. I chair that board, so I know that review very well. I've lived in the area for 40 years. I was not aware of the particular issues for Roma Cypriots as opposed to Greek and Turkish Cypriots. We can't know everything, and actually, we can be humble and just kind of accept that we need to know more, and building alliances I think is a really important strategy for all of us around trying to shift culture and make change happen.
Thanks so much. So another question, this actually came up in response to some of the chat within the chat. So and there was a comment around ageism as one of the factors, and the question is ageism so endemic towards older people that it doesn't get identified in safeguarding work?
I put that in.
Yeah.
Vicky, the reason I put it in
Okay.
because I think it's a really important conversation around this whole agenda. As social workers, we work with people who are marginalised for one reason or other, or several reasons, children and adults. And I do, given the hugely underreporting level of discriminatory abuse, it's one of the lowest reported forms of safeguarding abuse in adult services. I have to ask this question, and I've been asking this question myself since we started working on it from the first national SAR analysis. Is it because it's normalized, or it's because we become immune somehow? We don't see it anymore, because every person we work with will have experienced some form of, or is very likely to have experienced, I won't generalize completely, but some form or multiple forms of exclusion. And so our kind of barometer for it somehow is not as sharp as maybe it could be. And I think particularly with ageism, and at 71 I'm kind of seeing that a bit differently. It's like people you're invisible as an older woman.
It's interesting. Yesterday, when the WASPy women were spoken to across the media, they said exactly that they felt invisible. And I think they made themselves visible, but the people we work with aren't going to have that tenacity resource to do that. So absolutely.
Thanks so much, and thanks for that question, AD. That's so great. I think it's a really, really important point, having worked with older adults for a long part of my career. Is there currently, next question, is there currently an explicit process to evaluate intersectionality in these reviews?
I thought that was a really useful question in the chat, actually. And the short answer is that not one I'm aware of, but it is a really helpful challenge. And I think the simple answer is everybody experiences their own intersectionality differently. So personalization, if we go back to the language of the early part of this century, the noughties, the whole personalization agenda in some ways should, and I'm saying it should rather than does, should allow for the complexities of everyone's individual situation to be understood and articulated through any character assessment, etc., etc. I think there's a gap between how that how the should operates in terms of practice. So and there's a struggle in how you might provide a mechanism. I don't know with people who maybe because I think some of these debates are potentially more developed around the children's arena than in the adults arena. Whether there's anything there, I wouldn't know. But from the adult side, I haven't come across anything yet. That's not to say we shouldn't look at that. And Vijay, it's a conversation we can have in another
I was thinking that
context,
exactly.
in our other roles, to see how to take it forward. I thought it was a really useful challenge, actually.
Absolutely.
And another question, just aware of time, I think we might not have time for too many more questions, but can I clarify what best practice, this might take longer than 2 minutes, sorry. Can I clarify what is best practice when working with domestic abuse? Training I've had has always been, do not use, in inverted commas, flowery language, say what you see. What is the risk, the impact? I always operate in a trauma-informed way when doing this, but I get the feeling sometimes management are not keen on this approach.
Interesting. I think we're all, those of us who are registered social workers, have a responsibility to our registration. I recently wrote an email which started by saying I'm a registered social worker, and it's our professionalism, isn't it, to include in the records what happened, because usually it is women, but the victim, whether it's a man or a woman, of domestic abuse will not see it in any flowery language. They will experience physical pain, emotional pain, and trauma. So I think our records, and certainly in some of the reviews as well, we need to reflect that. And I think that increasingly there's emerging research and domestic abuse and information and actually practice on the ground to reflect that. I think that's important. Domestic abuse.
But I kind of slightly differently, which is a belief that whenever I write or record, I need to make it clear and simple, and that may make my life difficult in terms of having a conversation with the person I'm working with, but I'm not hiding what I'm seeing. And I'm being honest about it, as opposed to, I think the bit about flowery language means, oh, we're trying to hide it, we're trying to soften it. But actually, I should go back to plain English, simply because I think we have a duty of care to be able to explain what we see and why we see it.
I think one of the ways to do that is to write what is the punchy language, and that is that he punched her, that sort of language, and then to do the reflective organizational professionalism bit on as well, so that you've got both. But I think to not include that is minimizing what's happening, which is not what we want to do.
I've got one more question, and this really is a bit of a corker for 2 minutes, so apologies for that.
Thank you, Vicky.
But I think maybe people can put into chat as well some responses. If most social workers are white, British and female, where would good sources of information be to get better understanding of other cultures and backgrounds?
So someone's already in the chat asked each other, and some work that a team's been doing which is diverse, that they can ask people and colleagues, which I thought was really helpful. Sorry, Vijay, I interrupted you. You go.
That's okay. Yeah, absolutely. You've got resources around you, but also ask the family. I think we're curious, and actually, whatever discipline, we should be curious. So we can say, actually, what is important to you? Oh, do you celebrate Christmas? Just an aside, my mother-in-law went to an Asian elders lunch club yesterday, and she was really fuming. They're saying, they're doing Easter. Why are we doing Easter? I'm a Hindu. I don't celebrate Easter. But actually, if everybody asked her, what would you like to celebrate? We'll celebrate Holi. Absolutely, makes sense to her. So it's actually, if it comes out to the first point, let's talk to the family, let's talk to the individual, what matters to them. And as I said, we're all different. Whatever faith we have, whatever sexuality, how we use it, how we manage it is different. So we need to understand that personalized context, coming back to person-centered practice.
And thank you so much for that. I've really enjoyed the session, and I actually really enjoyed the interactivity. We've had a lot of conversation going on the chat. We've had people giving advice to each other, putting in resources for each other, and it's been a real fantastic session. And thank you for allowing the extended time for questions and answers, because there's some really great questions and answers in there.
Can I give one reflection just from the hour? I think I want to say two things. I think I want to sort of just really welcome the range of people out there. And there's people like Addie, who's been championing Asian for numbers in all the time I've known her. There's people like the board at Hackney who champion Child Q. There's a whole lot of people who are out there doing the right things. We need to celebrate that. We need to get better, but we should also just recognise and celebrate all those people who've been pushing on all these different issues over a period of time, and actually just build on what they've been doing and building on those legacies of Fran and Marcy and others. We can all do that.
And that's a fantastic message to leave on. Just in my terms of kind of finishing off with housekeeping, my colleagues put into the chat a feedback form. Really would appreciate you completing that. You can also email us on socialworkweek@socialworkengland.org.uk with your feedback. We will be sending slides out. And we've also just launched a survey for social workers to gather thoughts on regulation, professional standards for social workers, and the roles of social workers in society. So those links are in the chat. Please do respond to them. Really helpful. Thank you all for your time. I know everyone's very pushed. Do have a look at what else is on Social Work Week, and have a nice weekend when it comes. And thank you all.
Thanks.
Thank you, everyone.
Thank
Bye.
you. Bye.